Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. We are not in studio, but we're available to you. You can give us a call, 888-630-9625. Love to talk to you on any subject I have in mind. Perhaps you've had a problem, you've tried, you've applied. Well, let's see what we can do to put the fire out without drugs, without surgery. Have a very special program for you today, and somebody who many of you are familiar with, a guy that's near and dear to my heart, the professor, Dr. Harlan Browning.
Good morning, Tom.
Good morning, my friend. We're going to talk about something that's extremely deadly to most people.
It certainly can be, and this time of year with all the raking.
Raking and slipping and falling and lifting and doing all those things. So we're talking about what?
We're going to talk about low back pain and the things that contribute to it and ways to fix it and why we're failing at it right now in medicine.
Well, this weekend, actually this week, Wednesday, you are going to be our presenter, our guest, and our host. We're going to be talking about low back pain at the Roselle Center for Healing. And for those of you who would like to join Dr. Browning, all you need to do is call 703-698-7117. And just tell my staff you'd like to be here, and we'll be more than happy to have you our guest. Dr. Browning, Harlan, listen, what's the incidence of low back pain? Why is it so devastating? Why does it take so many people out? Why does it cost us so much?
Well, outside of the common cold, it's the most common reason that people go to see a doctor for any kind of complaint. So, number one, it's very prevalent. I don't know the exact numbers on how much money is lost from work time, but it's dramatic.
So when somebody has low back pain, it not only shuts them down locally as far as their inability to do things on a day-to-day basis, but it also shuts them down relative to their income, their ability to provide for their family, their ability to participate in life generally. So if your back hurts, nothing moves.
No. And you change the way you stand, sit, think. And one of the things that we don't talk too much about is when we're in chronic pain, it's going to change the way our brain function.
Well, you know, having been one of those patients, and you take care of me on a regular basis, I know what low back pain is. And when I try to take care of patients on a day-to-day basis, sometimes it becomes not only a challenge, but almost impossible for me to do my job. But fortunately, I've been able to be treated by you and other docs in the office, and I'm able to handle that. And as you know, that comes from several accidents over the years. But there's so many people out there that put up with low back pain by taking medication, by having had injections in their spine, by having had surgery that fails them. So what's the step? What's the identifier? Let's talk about what types of low back pain there actually is. And I know there's a differentiation between muscle spasm, disc problems, pinched nerves, feedback relationships from the internal mechanism at the bottom. What's the differentiations? How can you tell the difference between this, and how do you know when you should see a doctor?
Well, I think that the most common reason people have low back pain is what we call mechanical, which means that the structures in their low back, their discs, the joints, the musculature starts to break down over time. So that's the real localized low back pain. If we get a referral or that sciatica, then we know we have a nerve that's getting compressed. in either situation, you need to identify the causation and certainly look at what the person's doing to contribute to the problem. Usually there's ergonomic changes that are happening at work, or there's things that they're doing in their diet, they're not staying hydrated, or they're just not exercising.
Let's talk a little bit about that hydration piece, because I see that in so many different cases. Patients come in and they said, I hurt. And it all started slowly, and I don't have any real, this is what happened to start it. But when you begin to talk to them, the one thing that's evident is they drink a ton of coffee, they drink no water, and their diet is not anything but vegetables.
Well, if we eat inflammatory type foods, we get inflammation, and inflammation propagates pain. So for a lot of folks, they're caught up on this wheel. They need the coffee to stay awake, but when they drink it, they stay more inflamed. They get more pain. Then they have to take painkillers, and then the pattern just propagates over time.
Let's talk about that water piece for a minute. I described the disc, that shock absorber in between the two bones, like a sponge. And the truth of it is that it's made of two pieces. It's got an outer shell called the annulus, and it's got an inner piece that's very soft like toothpaste. And when you begin dehydrated over a period of years, that disc begins to shrink. So it's like an old sponge that's hard and broken. But if you take that sponge and you put it in a petri dish with water, it slowly imbibes the water and thickens back up.
Yes.
So some people, all they have to do to fix their low back pain is drink water.
And move. The discs actually accumulate water through a process called imbibition, which means that it's a pumping mechanism that's built into the disc. So when a person gets up and walks, the disc actually compresses, and then it expands, so that pumping mechanism sucks water in. So the lack of movement and the lack of water contribute to the degeneration.
This Wednesday evening, Dr. Harlan Browning will be your host, your presenter at the Roselle Center for Healing. He's going to be talking about low back pain. And those of you who know Dr. Browning know that he has an insight to the subject and the mechanics of the body that few people have. I'd like to invite you, I'd like to encourage you to join us. 703-698-7117. Give us a call. We'd love to have you as our guest. And Dr. Browning will be here not only to present to you and give you information that you probably don't know about, but to give you specific direction and individual consulting if you like to grab them afterwards. Let's talk a little bit about the mechanism. Let's go back to the water a little bit. I have another question. A lot of patients will tell you that I drink water, doc, but you see by the x-rays the disc is degenerative. You know by testing the spinal system and the ligaments and the muscles that the patient appears to be dehydrated. When that occurs, why, if we're making the assumption that the patient's getting the water, that they're not getting the water into the body, into the disc? What's causing that not to happen?
Well, it could be certainly that the body needs water in other places. So we have a priority system, and unfortunately our musculoskeletal system is on the bottom. So if we're slightly dehydrated, we're going to take that water and put it in more essential tissues. So just because we're not thirsty doesn't mean we're dehydrated.
One of the things that I'll tell patients is that, one, I'll relate what you just said, but I tell them take a little sea salt, not regular sodium chloride, but sea salt, put it in, and allow the tissue to pull that water in. And that seems in many cases to help them. We're here at 888-630-9625, 888-630-9625. Give us a call. I'd love to talk to you on any subject that you have. We're talking about low back pain. So you talked about nerve compression, and we know that there are very few places in the body that you actually get bone-on nerve compression. But the low back at L5 disc space is one.
Certainly.
But there's a thing called stenosis. And, people get diagnosed with spinal stenosis. Their doc says surgery's the only way out. Or learn to live with it, and they put them on tons of different medications. What's your thoughts?
Well, there's two types of stenosis. One we call central canal. That's where the actual canal where the spinal cord goes through is getting narrower. And that can be congenital, which is not very common, but you actually hear about that more in football after a patient takes a headshot. and they do the MRIs, they find out the guy has a canal that's too narrow, so his career's over. They put him on the bench. But the most common reason is arthritis. We degenerate, and the arthritis crowds out the space, and then ultimately the nerve gets compressed.
So is that hard, fibrous scar calcification that fills into the canal and occludes the nerve?
That's it.
So how does someone prevent that?
Well, you have to have a good functioning spine to begin with. If you start to have any kind of pain, you need to investigate it. And certainly you need to find something that's going to fix the situation and get yourself in a place where you're healthy.
You know, so many people live with this type of situation the rest of their lives. And you see them walk in, they're on walkers, they're on canes. If they're sitting, they kind of feel better. But once they get up and they move around, the weight of their body on that disc space brings the symptoms out. And it's because they further occlude it because of the gravitational compression.
And you bring up an interesting point about the person with the cane or the walker. Most of the time with stenosis, the person is using that cane or walker not because of the pain, but because of the weakness that develops. Because you've got to remember, those nerves not only communicate sensation, they take motor. So if we can't talk to our muscles, we can't use them, so we get weaker. And you can see a telltale sign is when a person gets up out of a chair, they have to walk themselves up with their hands on their legs or on the arms of the chair. That means that they most likely are developing stenosis and weakness.
Let me ask you this, and this is many of our listeners are probably wondering. We're telling them how bad this thing is and how devastating it can be to their lives. Can you fix it?
Sure. Depending on the situation and how far is progressed, there's tons of things that can be done. The one thing that you can't let go by is the fact that if you're having pain or you're having problems, you need to get it looked at, because the longer it progresses, the more permanent it becomes. And when we're talking about arthritis, it's going to choke those nerves. So in most cases, it can be treated very effectively, but you need to do something about it.
What's the fix?
The fix is to decompress the nerves if they're getting compressed, get the joint surfaces to move better, rehydrate the body, and rehabilitate all the structures that surround it, so the musculature, the ligaments, the tendons.
And changing the chemistry.
Chemistry, certainly.
Yeah, I was talking to a good friend of ours down at the Virginia Chiropractic Association convention last weekend, and he was telling me about a patient of his that had bone-on-bone in their knee, now differently than the low back, but we're talking about the same situation. So what he did with this person, they wanted to do a full knee replacement, and he decided, listen, this thing can be fixed if the patient was willing. The patient bought one of the back slings, the back beds that you turn upside down. Mm-hmm. So the patient also bought a low-energy light laser, which obviously is very expensive. So every night he would go home and he would hang in the back sling from his ankles, so the gravity would pull against it. He would give them the different enzymes, the chondroitins and so forth, to try to repair it, changed his dietary patterns, did some acupuncture with him, but at nighttime he tied the laser to the knee. So the laser was on the knee all night long. Within 90 days, he regrew and regenerated over 2 millimeters of disc.
That's impressive.
And, I looked at him, I said, I want the formula. But that's, we know intuitively and we know theoretically that that's possible. But here's one of those things. I said, you're going to publish this, aren't you? And he said, yeah, absolutely. He says, check the next JMPT journal.
Sometimes we forget about the miraculous things that we see in practice every day, but action steps are the most important thing. When people take action, they get results. When they just take the Advil or the Motrin or whatever, they're going to get the same old, same old. That's the problem. And, we buy into the Fifth Avenue marketing, and it's so precise, it's so on target, and it's so seductive that it makes you think that there's no other course than taking these drugs, the Celebrex and so forth. The problem is it makes it worse. Yeah. We're coming up to a break. We have to listen to some very important information. Don't go away. We're here at 888-630-9625.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're here at 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. We're talking about low back pain. Love to help you through it and love to get you live again and working and doing the kind of things that you'd like to do, because this is a problem that affects so many different people, and subsequently it takes your life out of living. It's no fun. It's not a good thing. Here in studio, Dr. Harlan Browning, who'll be your host, your presenter this Wednesday evening, and we'd love to have you as our guest here at the Roselle Center for Healing, and all you need to do is call us at 703-698-7117. That's 703-698-7117. If you have questions and you don't get a chance to call us during the program, you can always get a hold of us online. You can go to rosellecare.com. That's rosellecare.com. And send us a note. We'll get back to you. If you have a message for Dr. Browning, he'll get back to you as well. Having said that, Dr. Browning, let's talk a little bit more about this low back problem. We said it affects millions and millions of people. You said it's the second most common reason people go to docs' offices. But we're talking about spinal stenosis, but there are many other things as well. Let's talk a little bit about a low back problem that just suddenly shows up. Patient wakes up in the morning and they got low back pain. And now it's been there for a period of time. They have no history of injury. What are your thoughts on something like that?
With acute low back pain, that's what you're referring to. I often kind of look at what they've been doing the 2 or 3 days leading up to that. The way people sleep, believe it or not, that's a big contributing factor to low back pain. So if you're sleeping on your stomach, or you're sleeping on the couch, you'd be surprised how many people tell me they actually sleep on the couch or in a chair to prop themselves up because they have reflux or GERD or things like that. It can cause constant irritation to the low back musculature or the nerves, and then all of a sudden we wake up one day and the person says, I barely could get out of bed.
What's the best way for somebody to sleep?
A side lying or on your back, preferably with just one pillow. But there's a lot of folks that have to accommodate other disorders like that reflux, and they have to change the way that they sleep. Or maybe they have aches or pains in some other part of the body, so they have to prop themselves up. And you've been in this business a lot longer than me. When you start talking to folks when they come to the office and you do the history with them, you find out the way that they have to change their life for their issues. And because they're not life-threatening, or because they're so used to having them, they just continue to change them, and unfortunately, they're accumulating other issues as time goes by.
It's interesting. One of the questions I'll ask patients is that, because of your pain or because of your discomfort, what have you had to give up in your life? And, they look at me like, well, what a weird question. And they'll say, well, as long as I take my medication and I don't lift my son, or as long as I take my medication and I take it easy, I used to be able to go out and run or walk long distances, but I don't do that anymore. And I look at them and I said, and that's okay with you? That's something that you want to deal with the rest of your life?
Well, again, a lot of people assume when you get older that there's things that are just hard set, that they're going to happen.
What do you expect for your age?
Right. So when things start to deteriorate, they just attribute it to the fact that they're getting older, and you know what? They're fine with that. I personally wouldn't be fine with that, but they're fine with that. Fortunately, when we sit with them, we basically counsel them about that. That's not okay. These are things that you should be able to do. Just because you're 60 years old doesn't necessarily mean you need to give up skiing.
Or 70 or 80.
Right. So, there's a process of fixing the issue and then really fixing the mental state at the same time.
Well, our mentor, the founder, the father of our specialty in applied kinesiology, a guy by the name of Dr. George Goodhart, was an amazing human being. George died at age 90, and he died with his boots on, so to speak. He was continuing to practice and so forth. And up until he died, a year before, we were on the slope skiing with this guy. And, George was very vital, and he was very vibrant, and his mind worked very quickly and so forth. And, he would always do things to help himself. And there's so many people, so many of our listeners that buy into what do you expect for your age type of paradigm, or they look at, well, I'm just too busy. I've got so much on my plate. I can't take the time to. Or, they just don't take those few minutes to start strengthening their body, to strengthen the core muscles, to get motion and get function, get vitality, and they end up producing their fear. They begin to break down.
Or they just propagate what's already there.
888-630-9625. That's the number here at the studio. Back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio. Give us a call, 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. My guest today, Dr. Harlan Browning. We're talking about low back pain and all the things that can cause that and how it can be devastating to your life, your capacity to do the things that you want to do, not only keeping you in pain, but losing function as well. Not a good thing. We've had several people lining up to talk to us, and we'd like to get to the phones. And, Gordon, you've been waiting a while. How can I help you, sir?
Yes, I have a 17-year-old exceptional athlete who was diagnosed 4 years ago with spondylosis, and he has no pain or anything since then, but I'm wondering if there's any cure for it since it doesn't.
Gordon, let me ask you a question, just clarification. Is 17-year-old spondylosis or spondylolisthesis?
No, spondylosis, not listhesis.
Okay, at 17 years old, the spondylo, when we'd say this is spondyle, you have spondylosis, degenerative spondylosis, spondylolisthesis. In a young person, it's usually a result of a fracture of the gliding points that hold the vertebrae in position. And without knowing specifically, it's highly unlikely that it's a spondylosis, degenerative spondylosis. He's way too young for that. It's more likely that he has a slippage of the vertebrae, one on top of the other. And if that's the case, it's a result of the facet, the pedicle, being broken. And it's not something that he did necessarily even out of injury. What happens genetically, there are some people that are born with a thinning of this gliding point, and you don't see them before 2 years of age, but they usually show up between 2 and 10. And then at 10 years old, between 2 and 10, if they're going to migrate, they're going to move forward. The other thing that could cause them is a car accident, and due to seat belts. That's one of the reasons that they started putting shoulder harnesses in people. Because years ago when they just had a seat belt and you were rear-ended, it would throw you forward, and it would actually break the vertebrae at the lower portion of the spine. So let me ask you another question. Was this found kind of secondary to just an examination? Was it he was complaining of low back pain? What was going on? How did they find it?
He was playing baseball, and it's a twisting sport. And he also, when he started to play football, he started to have some low back pain, and we had a bone scan, and it was diagnosed at that point. And they just put him in a back brace for about 3 months, and then he has not had any symptoms since. He actually deadlifts 500 pounds and cleans 250 4 years later. So, but I'm worried that he's not going to heal because some sources say it doesn't heal.
Hey, Gordon, Dr. Browning here. And you said the injury was about 4 years ago?
Yes.
Yeah, so unless there's some underlying condition that he has, bone condition, it should be completely healed. The question very often is it stable, meaning similar to what Dr. Roselle was saying, do the areas where the two vertebrae meet, do they move too much? So it's very simple to do what's called a flexion and an extension study, which is an X-ray standing where your son would actually bend forward and then lean back, and it would tell us if the vertebrae are staying on top of each other or if one is shifting forward. Now, if they're shifting forward with flexion extension, that's where it gets a little tricky as far as the stability and safety, and that's one of the situations that if he injured it again or got tackled from behind, it could be that could be not a good thing.
Gordon, the fact that he's able to power lift as much weight as he is, my commentary would simply be this: as long as he keeps a solid core. Let's take it in two different situations. If the vertebrae was a fractured, genetic predisposed situation and he had some forward slippage, then, and it's stable at this point enough for him to do that sort of situation, he's going to have to spend the rest of his life making sure that his body is very, very much in shape. Now, if he wasn't a jock, if he wasn't an athlete, and he was at a good weight and he was taking care of himself, he may have gone the rest of his life and not even known that was there. But the fact that he is an athlete, you have to make sure that you know how stable this thing is. Again, going back, I've had many, many athletes. We treat a lot of professional players as well that have spondylosis. Depending on how stable or unstable will tell you what can happen as time goes on. But without seeing his x-rays, without examining your son, you have to make sure that structurally he's balanced, but more importantly that his muscles around his body, around his core, his stomach, his back, his legs, his buttocks, and so forth are strong. They're as tough as they can get. But again, going back to the fact that he can lift that kind of weight suggests to me that he's probably very stable.
Yeah. Can you repeat the name of that stretching test?
It's a flexion extension X-ray.
Flexion extension X-ray. Thank you.
You're more than welcome. Thanks for calling. 888-630-9625. We're talking about low back problems, and we'll try to answer your questions as best we possibly can. We have another caller. How can we help you? Hello?
Hello?
Hi, how can we help you? This is Dr. Roselle.
Oh, yes, Dr. Roselle. I exercise. I'm in my 70s. I exercise a lot. I dance a lot. I'm very active. But when I exercise, things never get easier. When you get young, when you're young, you build muscles. Can you still build muscles when you're older?
You can.
Because I just don't seem to be able to uplift in weights. I always have to stay the same. I'm seem like I'm maintaining more than anything else, but I don't develop.
Well, here's the problem. As we get older, there's this thing called growth hormone that starts crashing. And so subsequently, you can't build the kind of mass that you used to, particularly if you stay the same that you did years ago, if you eat the same way and so forth. There's two times of your life that you need a lot of protein. One when you're young and you're growing and you're building muscle, and the other when you're old and you're tearing it down and breaking it down. You need much more protein in your body. So the other piece is that you have to find out what your hormone balance is and find out what your fight-flight system is doing, your adrenal glands. But in a real world, yes, you can build muscle at your age, not like you were when you were 16 or 18 years old, but you definitely still can build muscle, but you have to look at all those pieces. When a patient comes in and we look at them and that's their goal, they want to maximize their health, we take a look at what the nervous system is doing, we take a look at what their biochemistry is doing, their dietary patterns, but also importantly find out what their hormone mix is, and then we can begin to adjust and alter that, and we see some remarkable changes, but it takes us and the patient as well to achieve that. Does that make sense to you?
Before, maybe I can come down and see you again then.
Love to see you. Give us a call. Come on in and let me know that's the deal, and then we'll set it up and make sure we get all the data that we need to get.
Great.
Thanks for calling.
Let me add something to what you said about testing for hormones. The interesting thing, when we test for hormones, we almost always look for the ones that we consider to be anabolic, that build us up, the growth hormone and testosterone, like you mentioned. But it's becoming more and more my experience that it's not necessarily has to do with totally about the amount of the hormones that build us up, but more so about the hormones that break us down and the hormones that give us secondary characteristics like estrogen. Most folks don't realize that guys produce estrogen.
Absolutely.
But if the ratio of your testosterone, that's the one that builds us up, and estrogen, that's the one that in a guy that basically smooths us out, if that's too high, then it's going to counteract the testosterone. So in some cases, the idea is not to boost the testosterone, it's just to lower the level of estrogen. In the environment, we know we have chemicals and other things that we refer to as endocrine disruptors, which means that basically they sabotage the way our endocrine system works. So if we're getting these things in our diet, which we do, and if you're eating foods that have a color associated with it or a number, if it says red 22 on it or blue 17, these can disrupt our body chemistry. And if you're drinking out of plastic or eating a lot of soy products, these again can build on it. So getting back to the last caller, he might be best served by not necessarily trying to bulk up his testosterone, no pun intended, but to maybe change the way his body's producing estrogen or the other associated hormones that we don't talk about, or at least don't get a lot of PR.
I agree. And the conversion, because we know that that DHEA converts and triggers progesterones and all the other hormones. And if you're going to the androstenedione, if it goes into estrone or estradiol, we're in trouble.
Right.
And you start breaking things down.
And then I know we're supposed to be talking about back pain, but this is actually
part of it.
Very much so, because as we lose muscle mass, we're going to have more back pain. So another sign that people can look for, guys, is if they feel like they're just getting weaker, okay, and they're also losing their hair. Okay.
Don't look at me, Doc.
No, I'm not looking at you.
Okay.
In other words, that they're just all of a sudden they're going into a bald type pattern. It probably refers back to what you just said, that we're converting testosterone to one of its, stepbrothers. Yeah, called dihydrotestosterone, which is the one that causes us to lose the hair on our head, but actually put hair on other parts of the body. So again, it's kind of figuring out where the gear that's not turning is.
Yeah, so guys, if all of a sudden you lose it on top of your head and you gain it, you're putting fur on your body, that's exactly what's happening. Your DHT level's getting higher, and actually your estrogen levels are not stable.
Right.
And as Dr. Browning said, when you're drinking any kind of fluids these days, because of for example, Fairfax County in Virginia is a water reclamation area, as most of the Washington metropolitan area is, and that means that they're taking your sewage water. I'm sorry if we have sensitive ears right now, but they're reprocessing it and putting it into your drinking water. What that means is that there's a lot of hormones that get it put into that system through urination that they can't get rid of totally, and now you're upregulating. We're seeing more estrogen type of problems, breast cancers and prostate cancers, simply because of the fact that we have all these environmental triggers, including electromagnetic fields, and we know that will cause estrogenic effects within the body. So we have all these things to worry about, but it can be altered, it can be fixed, and at any age you can repair and build muscle. The body wasn't supposed to degrade. It's supposed to go down very, very slowly, providing that you take care of yourself. We're here at 888-630-9625. This Wednesday evening, Dr. Harlan Browning will be your host, your presenter at the Roselle Center for Healing. If you'd like to join us and get as much information as you possibly, matter of fact, you get probably more information you ever thought was possible, particularly from this guy, give us a call at 703-698-7117. That's 703-698-7117. Let's talk real quickly on the visceral reactions. Got about a minute before we have to take a break or two, but we talked about it a little bit in the first half, but there are times that our organ systems will reflect back pain.
Certainly. Because our organs share the same circuitry, the same nerves as our muscles, they cross-communicate. So when we have irritation in the organ system, and that doesn't mean disease or pathology, it just means that it's not working optimally, it'll often reflect itself in a muscular response. We're all certainly familiar with what happens when we're having a heart attack, and people get chest pain, but they also get pain down the arm and they get jaw pain, and the reason for that is because those nerves they cross-communicate and talk, so it refers, and people get gallbladder attacks. They might get shoulder blade pain. So one of the things that I look at if we're going to consider the person's problem to be partially visceral or completely visceral is urinary function, okay, prostate function. Very often there could be a subclinical urinary tract infection that's just not been found because there's no burning or anything like that, and that could be causing the person's low grade on again off again back pain. A little bit more common in females than males, but again it's definitely something that can be visceral in nature.
Yeah, subsequently when they have a bad menstrual cycle, they can have horrible low back pain, and many ladies experience back labor instead of having traditional pain in the pelvic region and so forth. That's that referred mechanism that they're getting from the uterus, and it happens across the board in so many different situations.
And I think it goes back to the applied kinesiology we utilize in the office. When we have a patient come in and their complaint is back pain, there's very often, unless they've been to a provider that does similar things that we do, the assumption is that we're just going to treat this mechanically. Okay, your back hurts, we'll manipulate it, we'll do some physical therapy, some electrical stim. These are typical procedures done in the rehab setting. But very often we expand that criteria in which we help the person by supporting the organ system or supporting digestion. And at first the person doesn't get it. But when you start to give those areas the nutrients they need, then all of a sudden they see their problem get better, then they're quite amazed.
We're coming up for a break. Dr. Harlan Browning will be your presenter, your host this Wednesday evening. Give us a call at 703-698-7117 and register for his class. We'll be right back after some very important information. This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle web store. That's drtomroselle.com and click on Roselle web store.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
WMAL-FM Woodbridge, Washington. WMAL Washington. WRQX HD2, Washington.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. We're here every Sunday at 12 noon, bringing you the most intimate information in integrative care. Hopefully we can light your fire. We can make you think. And as I've said always, don't believe anybody, including me. Do your homework. If I don't do anything but provoke you to make sure that you get out and you do the homework and you investigate both sides of the paradigm, then I've done my job. That's why I'm here. That's why I do this program every week without fail, and I try never to make it recorded because I want you to have a bully pulpit someplace you can go for information. My guest in studio, Dr. Harlan Browning. He'll be your presenter, your host this Wednesday evening at the Roselle Center for Healing. Love to have you as our guest, and he's going to be talking about low back pain and the things that you can do to prevent it, all the things that bring you to that place and you don't know what else to do. Well, there's a lot that you can do. Give us a call at 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to join us. It'll be at 7:30 p.m. this Wednesday evening. Please be with us. Dr. Browning, let's talk a little bit more about the subject of low back pain and why medications don't work.
Well, medications usually are there to address the symptom pattern. Certainly in the case of painkillers and muscle relaxers, anti-inflammatories are to do exactly what they say, get rid of inflammation. So, on the short term, they make you feel better, but if you're taking them on the long term and it's not really changing anything, then there's an underlying situation there that really needs to be addressed. What you have to realize is when we have pain, that basically means for the most part that there's some sort of tissue that's getting irritated, and as time goes by, that tissue is going to deteriorate and it's going to be destroyed. So you need to jump on it.
Well, these patients come in with all kinds of medications, and they're on anti-inflammatories and painkillers or combinations thereof. And the truth of it is, with an anti-inflammatory, if after 72 hours they don't work.
A lot of times they don't.
That's the end of the story. So if you're taking it forever with a chronic problem, chronic meaning that you've got, chronic means old and hard and cold and so forth. There's really, you're dealing with pain pattern from something other than inflammation. And the inflammatory pieces of that medication don't work. But if you're taking something like Celebrex, it has huge side effects.
Sure. Well, the saving grace, I think, is that most people don't want to be on medication. They just don't know what to do because that's their only option. So
they're also afraid of offending their doctors.
Yeah, they don't want.
How many times I've heard that make me crazy.
They don't want to get them upset. That's for sure. So it's more about giving them other options and laying them on the table and showing those options and showing how it affects the body and how it changes it. Because ultimately we're looking for a change. We want to see a demonstrable situation change, not just the pain pattern, but we want to see the functionality and the stability become better, because then we know the person is getting well.
We want somebody to be able to return to life.
Correct.
To be able to have their cake and eat it too, so to speak. Be able to pick up their child, be able to go out for a long walk, to be able to hike a mountain trail, to be able to do the things. But it takes that cooperative effort between the doctor and the patient. In all the years I've been in practice, the 37 years I've been doing this, I have yet to see a condition that can't be made hugely better if the patient is really willing to commit and get rid of the excuses.
And that certainly carries over to people who've already had surgeries on these. That's the big question I get all the time. It's like, Doc, well, I've already had surgery and it didn't work. Well, that's because you didn't need surgery, and that's why the probable outcome is going to be even better from you, because there's something mechanical going on that you can most likely address yourself. You've already tried the surgery, and that didn't work, so surgery wasn't the fix, so it's something else. So, it doesn't matter what they've been through or the road they've walked. It just matters about them stepping up to the plate and doing something about it.
The interesting statistic on surgery, too, is that they consider it 50% beneficial. That means that it didn't get any worse than what it was before they went in for the surgery. Not a really good thing. We're here every Sunday at 12 noon. Join us again. Tell your friends about it. And if you need to get a hold of us, you can always call us at 703-698-7117. And tell Dr. Browning that you'll like to be here with him on Wednesday evening, and he'll give you much more than you can possibly even begin to think of. We're here always for your edification, for your health, to make you stronger, better than you've ever been before. We'll see you next week, same time, same old place. This is Dr. Roselle. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give